Okay, my name is Abigail Loja, and this is my presentation on HIV signs, symptoms, and diagnosis for my Bio 121 class. For an overview, we'll be talking about early HIV symptoms, chronic symptoms, advanced/defining AIDS symptoms, why these symptoms can happen, like for biological mechanisms, who's most affected, diagnostic tests, like types and what they detect, differential diagnosis, and summary. Okay, early HIV symptoms. This is called the acute stage. So during the first 2 to 4 weeks after infection, HIV can look like the flu, mono, or COVID-19. Common early symptoms consist of fever, fatigue, rash, sore throat, headache, and swollen lymph nodes. Why this happens? The virus is multiplying very quickly and the immune system reacts with strong inflammation. This stage is called the acute retroviral syndrome. Chronic HIV symptoms, which is called the latent stage. After early symptoms go away, HIV becomes quiet, but the immune system is still slowly getting damaged. These symptoms may appear for months to years. Persistent swollen lymph nodes, weight loss, night sweats, ongoing fatigue, repeated infections such as sinus or skin. Why this happens? HIV lowers the amount of T cells, which are crucial to regulating immune system responses. Advanced HIV and AIDS defining symptoms. When CD4 levels fall below 200 cells, the immune system can no longer protect the body. So here are some symptoms that means you have AIDS. Pneumocystis pneumonia, PCP, fungal infections such as thrush or cryptococcosis, Kaposi sarcoma, cancer, extreme weight loss, chronic diarrhea, severe bacterial infections. And why this happens, opportunistic infections take advantage of the weakened immune system. And here's just a graph showing how the CD4 levels decrease and increase with HIV treatment and with HIV infection. So why do these symptoms happen? HIV affects the immune system at the cellular level. HIV attaches to CD4 receptors on helper T cells. The virus enters the cell, copies its RNA into DNA, and forces the T cell to make more viruses. Infected CD4 cells die. So that means when the CD4 count drops, the immune system loses coordination and the body can't fight off common infections anymore. And that graph is just showing what it does. So for groups that are most affected by HIV, there's a map showing the HIV prevalence map, which is, just across the board in all 7 continents, and one specifically for the US. Some patterns show that the higher rates occur in sub-Saharan Africa. So you see the darker red is like towards Southern Africa, which is where it's the most concentrated. Higher rates also in certain urban areas in the US, also kind of like the southern region of the US. And risk obviously will increase in countries/regions with limited access to healthcare, more poor countries, and lack of testing. So how was HIV diagnosed? For one, there's the antibody test, which looks for HIV antibodies. It takes a week after infection to turn positive, and it is used for rapid and at-home tests. The P24 antigen test detects P24 antigens and antibodies. It is faster and more accurate, and it is like the standard test. Lastly, there's the NAAT/PCR test. It detects HIV RNA directly. It is the most accurate and it is used for early detection and newborns. So there's not really any cons to that. And then to the right, you'll see just a graph comparing those three tests. For differential diagnosis, how doctors know it's HIV. As stated earlier, early HIV symptoms can look like the flu, COVID-19, mono, or even tuberculosis in later stages. However, how can doctors tell them apart? HIV tests detect specific antibodies, antigens, or viral RNA. Flu tests look for influenza antigens, and TB tests check for immune reaction to TB bacteria. So why does this matter? Symptoms alone cannot diagnose HIV, only lab tests can. And to summarize my presentation, HIV develops through stages, and each stage shows different symptoms. So early signs may seem mild, but they are important clues. Symptoms alone cannot diagnose HIV, so accurate tests like the antibody, the antigen, and the PCR are required to confirm infection. HIV affects the body by weakening CD4 T cells over time. This explains why symptoms progress gradually, and early detection makes the biggest difference. So testing early helps protect the immune system and prevents further spread. And then here are my references. And yeah, that's it. Thank you for watching my presentation.